evening everyone. So my next topic of video which I'm going to discuss with you is on the topic introduction to prescription writing. That is, in this video I will discuss with you the basic parts of prescription. Whenever the prescriber prescribes the drug, what are the various parts of the prescription, how to prescribe the drug, and what is rational prescribing, and other problems related to prescription are I'm going to discuss with you in this video. And before I start my video, I want to request you, if this video is useful to you and if it is helpful to you, kindly subscribe to my YouTube channel. That is Dr. Nitika Pharmacology Discussion. And now I'm going to discuss with you prescription writing. Now, what is prescription? A prescription is an instruction from a prescriber to dispenser. Means the patient comes to the prescriber with the disease or with the problem, with any symptom. The prescriber will prescribe the prescription, and this is the legal instruction given to the dispenser, like pharmacist, by the patient from the prescriber to the dispenser. A prescriber is not always a doctor, but can also be a paramedical worker, such as medical assistant, a midwife, or a nurse. Means it is not always a doctor. The prescriber can be a paramedical worker, a medical assistant, or a midwife or a nurse. Dispenser is not always the pharmacist. It can be a pharmacy technician, an assistant, or a nurse. The requirements. What are the requirements of prescription? What has to be given? Means we have to prescribe the drug which has to be given to treat the disease. To whom is to be given? Means what is the name of the patient? What is the age, sex, CR number, address of the patient? By whom it is to be given? The name of the doctor, registration number, address of the doctor, sign and date has to be given in the prescription. By whom it is to be given? For how much? Means how much is the tablet is to be given, what is the duration of treatment, and how often, what is the frequency, BT, TDS, QID, SOS, or OD. All this has to be specified. Means if it is given, how much it is the dose, how much is the dose which of the drug which has to be given, like in paracetamol which is prescribed, that is 500 milligram. Or it can be OD once a day, BD twice a day, TDS 3 times a day, and SOS as it may required, as it may needed. Instructions for administration, like other instructions, like in diabetes, we can say avoid sugar-free diet, avoid cholesterol-free diet, and you have to do exercise for at least 30 minutes in a day, and follow up after some treatment has been given, or follow up after some days, like 15 days. These are the instructions given by the doctor to the patient regarding the prescription and regarding the intake of the drug. So rational prescribing. Writing a prescription should be based on a series of rational steps. Like first of all, the patient comes to the doctor. He tells about the symptoms of the patient which is suffering from. And from the symptoms and various tests, various clinical laboratory investigations, the doctor makes the diagnosis. And then he specifies the therapeutic objective. Means what all other primary efficacy endpoints, primary and secondary efficacy endpoints which are to be met, which are to be treated. Like in blood pressure, we have to see for the lowering of blood pressure, systolic and the diastolic blood pressure by the normal 180 by 120 by 80 millimeter of mercury to the normal level it has to become. And select the drug of choice. Means we have to select the drug of choice which is the most appropriate drug to be given. Like in hypertension, in mild hypertension, diuretics like hydrochlorothiazide is most preferable treatment, and in moderate hypertension, ACE inhibitors, enalapril is more specific treatment. Determine appropriate dosing regimen. This is what we have. What is the dosing regimen, for how many times it has to be given, for how many days it has to be given, and for how much dose it has to be given. Appropriate dosing regimen has to be specified. Devise a plan for monitoring. We have to instruct the prescriber, has to instruct to the prescriber that you have to come after follow up after these days, after 15 days in diabetes and hypertension. and plan a program of patient education. Patient should be educated, means they should be instructed to use a sugar-free diet, oil-free diet, cholesterol-free diet, less spicy food has to be taken, avoid smoking, alcohol. All these instructions has to be given to the patient by the doctor. So what are the parts of prescription? First of all, the first part is the superscription, in which the doctor's identity, that is the name of the doctor, the address of the doctor, the registration number of the doctor, the qualification of the doctor has to be specified, and the date of the doctor has to be specified, along with then followed by the patient's name, age, sex, CR number, diagnosis, address of the patient has to be specified, and the date has to be specified in the superscription, followed by symbol RX, that is what to give. Then pharmacotherapy comes in the inscription part. Is what is the drug to be prescribed? What is the drug, like paracetamol, enalapril, hydrochlorothiazide, metformin 500 milligram BD for the diabetes mellitus. What is the pharmacotherapy? For what is the frequency of the drug? TDS, BD, OD, QID, 4 times a day, SOS. And what is the duration of treatment, for how much long the treatment has to be given? Instruction to the pharmacist comes in the subscription. Is what is the instruction, means how much tablets he has to give to the dispense to the doctor, to the patient, how many days, and how many tablets has to be specified in the subscription part to the pharmacist. And then signature. Instruction to the patient is the transcription. Instruction to the patient, like you have to take the cholesterol-free diet, sugar-free diet, oil-free diet, regular exercise, avoid smoking, alcohol, avoid spicy food, avoid caffeinated beverages. All these comes, instructions to the patients comes in the transcription part. And in the subscription again, it is the instruction to the pharmacist and the signature of the doctor and date. Now superscription, it is the physician name has to be given, patient information has to be given, diagnosis of the treatment, which has to, the diagnosis of a disease has to be specified, and treatment symbol has to be specified in the superscription part. Now what to audit means what we have to see in the prescription part, superscription part, what has to be given. All information about the physician and patient has to be properly written. Diagnosis or provisional diagnosis should be proper, it should be correct. RX symbol has been written or not. It has to be seen in the superscription part while critically appraising the prescription. Superscription, like date, doctor's identity, like we have to specify the name with degree, address, registration number, patient's identity, name, age, sex, address, diagnosis and treatment. This comes in the superscription. All these parameters come in the superscription part. Inscription is pharmacotherapy. What is the dosage form of the drug? Like tablet, capsule, syrup, solution, inhaler. What is the formulation? What is the dose given? What is the dosage form? Selected, what is the drug selected, what is the dose selected, what is the formulation selected. Means the how to audit. Here we have to see that handwriting is legible, drug selection is rational, generic drugs has to be given. In the inscription part, we have to specify that we prescribe the drugs in the generic name. Drug interaction, if more than one drugs are given, we have to look for drug interaction, that is that two drugs are not having any undesirable drug interaction. Non-pharmacological treatment has been written or not. Concomitant factors like renal or hepatic disease has to be considered. And order formulation is, if the injection is prescribed, it should be written first, followed by tablet, followed by capsule, followed by liquid, followed by topical. This is the sequence of writing the prescription. First, we have to write injection, then tablet, then capsule, then liquid, then topical. And if renal and hepatic disease is there, then we have to lower the dose, because in renal and hepatic disease, the clearance decreases, rate of elimination decreases, and there can be toxicity in the body. The subscription, it is the advice to the pharmacist regarding dispensing, is how many tablets has to be dispensed. It should be legible and write numbers as words, like 15 as 15 tablets we have to write. Transcription is the advice to the patient how to take the medication and what all instructions he has to follow while taking the medication. Like information on how to take, what is the, how we have to take the medicine, how many times it has to be given, duration, posture, relation to food. Avoid confusing abbreviations and non-standard units. We have to avoid the abbreviations and non-standard units. Signature, sign of prescriber and date. Means in the signature, we have to write down about the sign of the prescriber and date. And if it is missing, it is the not proper prescription. Important because of consumer protection, because of the Consumer Protection Act. It is important that sign of the prescriber should be there and date of the prescription should be written. Now this is the same thing that is in the superscription. We have to give the symbol, the name and age of the doctor, name, professional degree, contact number, address of the prescriber, date when the order is given, name, address, age of the patient, symbol, treatment has to be written, recipe, take, dose. This is the description example, like we have to write down about the dosage form. Like first of all, injection, then capsule, then tablet, then syrup has to be specified. Like generic name has to be written, strength has to be specified, the dose and duration. No capital letters are used in the inscription part. Subscription, it is the direction to the pharmacist regarding the dosage form and number of doses to be dispensed. So it consists of short sentences, and it also consists of the sign of prescriber, registration number of the prescriber. Now, writing of the prescription should be, it is the medico-legal document meant for an individual. There are no global standards for writing the prescription. It should be written legibly in ink. The prescription should be legible, and you should have to use generic names. And when the prescription is typed, the prescription has to be signed and dated by the doctor. Now, information to be given to the patient that comes in the transcription part, that is, what is the effect of the drug, what are the side effects of the drug has to be specified. Instructions how to take the drug, what to avoid, what not to take, whether to take it empty stomach, whether to take it without spices, beverages. Warnings has to be specified, future consultations follow-up has to be done, and responsibilities of doctor to ensure that treatment is understood by patient. The responsibilities of the doctor has to ensure that treatment is understood by the patient. This comes in the transcription part. Common error, there can be ineligible handwriting, insufficient information like frequency is missing or duration of treatment is missing, instructions are missing, or dosage form is missing, signature is missing, date is missing, details of patient are not full, details of doctor are not full, inappropriate drug. It means it is not according to the diagnosis made, rational drug is not being prescribed. Polypharmacy, when more than 4 or 5 drugs are used, then we have to look for the drug interactions and various adverse drug reactions when prescribing the drug. And all these things has to be kept in mind. So this is the sample of the prescription. Here this is name of the doctor, address, qualification, address, and phone number. This is name of the patient, age, sex, CR number, date, address, diagnosis is mild hypertension, and tablet prescribed is written. Amlodipine, which is the calcium channel blocker. Regular exercise comes under the transcription part. Follow-up after 15 days again comes under the transcription part. This comes in the subscription part, sign and registration number of the doctor and date. Thank you. That's all for the introduction of the prescription. That is how we have to write the prescription, how we have to critically appraise the proper pattern of the prescription. Thank you. Be happy, be healthy, be wealthy, be safe, stay happy. Thank you. Happy learning.